Okay, let's do this. So today I had two people that had their lower back that's bothering them. So I want to show you what you can do to try and loosen that up with the ball. So the first place, once you take the ball, is put it right, when you run your thumb down your back, you're going to bump into your hip bone down here. And so not right down the spine, but maybe over an inch or two. And you're going to find this kind of lumpy spot. So I want you to put it either right above your hip bone or right upon the bone and lay on your ball. Tennis ball kind of works. I like lacrosse balls a lot better because they're a lot firmer. And so finding a spot there, kind of wiggling around so you can find a spot that feels pretty uncomfortable. With your knees bent, if you let your knee lean over just a little bit, usually I find that works pretty good to get the pressure on it. You can put your leg wherever you want to, whatever gets you to the right position, if you want to let it tip over to the side. But just go in there, and I want you to hold it for a minute. So if you want to start a timer or just watch the clock, I want you to hold it for about a minute there. And what that does is that's going to attach to what's called the PSIS, or the posterior superior iliac spine. Spine? Sure. And it goes, the muscles that attach to it come down from your back. You got your lat, you have your iliocostalis, and then we also have our gluteus maximus that goes and attaches from the butt up. So we're trying to hit the point there where those are all converging and hooking onto that hip bone. Try to get that to release. After a minute, I want you to move it down 2 inches, so you can either lean to the side and roll it down, or you can just roll your body up. And so you move it down about an inch or two, find the next spot that feels kind of sore. With this one, I want you to let your knee tip over so that you're putting more surface area onto the ball. And roll around there, see what you can find. We're aiming for the gluteus medius, the minimus, just trying to find what hurts there. And I want you to hold that again for another minute. You can hold it still, or you can do some movement around, but just holding it. Embrace the pain, try and get it to let go. If it's too much, back it off, find a place that doesn't hurt too much. If you're making faces, it might be a little bit too painful for you for a good release to happen. So make it hurt, but make it comfortable enough that you can relax into it, let your body have its release. From there, I want you to move down another inch or two. And this one, if you want to cross your foot, or can cross your foot over your knee and just let it fall down. If that's really uncomfortable or that's too hard, you can either stay here or go back to the tip of your knee over and put the pressure there. This is putting pressure on the piriformis muscle, which the piriformis is the only muscle that lays over top of your sciatic nerve. So when women are pregnant, usually this muscle gets really irritated, causes that sciatic pain down the leg. But for back pain, a lot of times the back pain will start from a bulging disc or a pinched nerve in the back. It'll send signals down, that piriformis will just tighten right up there. So put some pressure on it, see if you can get it to calm down and release. Again, just hold that for about a minute and try and embrace the pain. Don't kill it too badly. If you feel a lot of nerve pain zinging down your leg, maybe take some pressure off of it. So I want you to do that on one side, a minute on all three of those places. Then I want you to switch that over and do the other side. So just hitting the other side just above the top of the hip bone or upon the hip bone for the first place again. Move it down another inch or two, find that gluteus medius, let your knee tip over. And the third one, gonna drop it down again, find the piriformis. Straighten your leg, cross your leg or your foot over your knee, let your knee tip over, and just let it hurt. So after you've done those releases on both sides, then the stretches I want you to do. So I want you to relax comfortably with your back on the ground, and I want you to pull your knee up towards your chest. Not just towards your chest, I want you to pull it opposite. So if it's your right knee, I want you to pull your right knee to your left shoulder. And hold that. You can either hold it still, or you can do a slow movement up and down, kind of get the different hip muscles moving around there, try and stretch them out. Get the muscles stretching, get the blood flowing, try and get it to calm down. This is usually pretty safe for backs just because the back is resting comfortably and safe in a nice neutral position while you're laying on your back. If it's pulling up through your back and it's causing a lot of pain, go ahead and either do it more gently or skip this one. The second one is bend your, so after you do that on one side, I actually want you to rest that leg, switch over, do the opposite side. So pull the left knee up to the right shoulder. You can either hold it. I want you to do these for about 30 seconds. You can go a little bit longer if you want to, but just kind of working that through the muscle. Let it stretch, let it relax, so you can get some of the tension out of there. It should feel good, it shouldn't be killing you too bad. If it is, calm it down, back it off. And then the second one, rest your left knee down. If you can, cross your right foot over your left knee. This might produce a stretch all by itself. If you can go further, the next step is you can pull the shin, hold onto the shin bone, and kind of pull that knee up towards you. And that's going to be stretching that piriformis muscle. If that is too easy and it's working really good, the next progression is you can try and reach through, grab behind your left thigh, and pull it towards you. And then if you want to lean your legs to the left a little bit more, that lean makes a big difference. So going there, holding that. This one is interesting because as you hold it, you think you're stretching pretty good. Give it another tug, pull it pretty hard. You can be kind of aggressive with this one and really get into it. You might feel this pull all the way up into your low back. Get that piriformis muscle stretching. So do that for 30 seconds. Rest in between. Let everything kind of simmer down, settle down. Cross your left foot over your right knee. If that's stretching, great. If you need more, go ahead and pull on that knee and shin. If you need more, grab behind that right thigh, tip your knee to the right. Let that extra little stretch get in there. And again, go ahead and be a little bit aggressive with that. Give an extra little pull. Breathe through the release. Take some good breaths. Let it stretch, let it hurt. And then last one, let's go ahead and grab behind your right leg if you can. If you can't, if you can grab onto your pant leg, grab a towel or something to help hold behind your leg. But I want you to see how high and how straight you can get your leg to straighten. And this is going to pull behind the knee up into the hamstring. As you move your ankle, pump your ankle up and down, you should feel that stretch through your calf. And most back people will probably be about able to straighten their leg that far, maybe this far. If you're pretty flexible, you might be able to get it all the way straight. If you can, go for it. I want you to do about 10 ankle pumps, just up and down. You might feel the nerve pulling and gliding through this motion. So I want you to do that for about 10 repetitions. Then I want you to do 10 circles. It doesn't matter which direction you do the circles. But just going around in circles, get that nerve flossing through there, let it stretch. And then I want you for 5 seconds to straighten that leg as straight as you can for 5, 4, 3, 2, 1, and relax. Bring that leg down, let it relax for just a second, and then switch to the other leg. Grab behind that leg if you can, straighten it as straight as you can get it, and then do ankle pumps. Up and down about 10 times. If these feel really good, you want to do more, you can do more. If the nerve is really pulling, you might feel it in the calf, you might feel it behind the knee, you might feel it in the hamstring, you might feel it in the glutes, you might feel it in the back. But doing about 10 of those, do 10 circles. Sometimes when I do this one, it really pinches in my ankle, and I can really feel that nerve loosening up as I move it. Do about 10, and then straighten the leg as straight as you can for 5, 4, 3, pull your toe back towards you, 2, 1, and relax. Good. So that's the deep release with the ball. There are some gentle stretches to kind of get the muscles that we just loosened up there. And then to finish off, I want you to lay on your stomach. If you have a bulging disc in your back, this position might be painful, might be uncomfortable. If this produces any symptoms down your leg, and whether it's into your glute, into your hamstring, or your calf or your foot, I want you to not do these. Because if you go into extension, it creates a binding, pinching feeling here, and sends any signals down your leg, that might be a reason not to be going into extension with your back here. So if this is too much, maybe don't do this stretch, or maybe just hang out here, see if it dissipates. Next step, if you can put both your hands down like you're doing a push-up, like you're doing a saggy push-up, you can call this upward dog, or you can call them press-ups. But I want you just to go up as high as you can, bump the pressure, then go back down. I want you to see if you can do 10 of them. Again, I don't want any increased symptoms going down your leg as you do these press-ups. But doing 10 of those, and see how you feel after that. As you get up, after you just put your back into extension, it wouldn't make sense if to go this direction if you have a bulging disc. You don't want to go and bend and flex that spine. If you have a bulging disc going on, I want you to go from extension, try to keep it to neutral as you walk yourself up to this position. As little bending from the waist as you can, try and keep it straight as you get back up. Well, I hope that helps. Tune in next time for some more back exercises that can help you relieve your pain and feel better.